Hi guys, this is a basic overview on how to perform an intake on a patient. I walk in the room, I always sanitize my hands and then ask the patient to verify the spelling of both their first and last name. Once they confirm that, along with their date of birth, I hit go to intake. If it's an adult patient, at this moment I hook the patient up to the blood pressure and the pulse ox. For peds, I wait until I'm in the vital section or when I'm done with my intake. But an adult, definitely get that blood pressure going. First thing you do is patient status. You hit with staff, what room you're in. Then you're going to add the reason for visit. I always glance at the little tab in the chart and say, okay, Mary, I see you're coming in here for a cough today. Tell me what's been going on. So I pick one and only one reason for a visit, and it's the most applicable. So cough. And then in here, it's a description of what's been going on, what the patient tells you, the narrative. You're painting a picture for the physician when they view the chart, what's going on with this patient. Patient told me cough for 3 weeks. If somebody says something's been going on for that long, I always ask, so what made you come in today? There's always a reason. This patient, it's getting worse. So I chart that. I always initial next to anything I type in Athena. That way I take ownership of it. You can either hit the next button over here, or you can click on these tabs. These tabs are designed to be a guide to help you through intake. So for training purposes, I'll show you the next tab. In the patient preferences tab, you're going to verify the pharmacy, and it's the one with the bolded star. So I would say, Mary, we have the Walgreens on 8 Mile and East Point. Is that good for your pharmacy today? And is your primary care still Sage Church? Okay, we verified that. In the vital section, hopefully the vitals are done at this point. If not, I chart what I can on it, and then I come back. I don't sit here and wait. So I would say, Mary, how much do you weigh? If the blood pressure was done, I would chart it. Always chart the patient's position, what side you did the blood pressure on, and what size cuff you used. If it's a manual blood pressure, you should chart that information down here. Oxygen saturation, is the patient on oxygen or room air at rest? Pulse, you only chart regular if you listened to it with your stethoscope, so I don't chart that part. And you're supposed to listen for a whole minute. So I just put the pulse and I don't put anything in that section. Respiratory rate, chart that. Temperature, how you took the temperature, and then pain scale. In the bottom section here, you have to write something on every patient. Normally my question is, did you take anything today for fever, pain, or discomfort? What this section is for is to tell the physician, did the patient do anything or take anything that may have altered these vitals, which would be Tylenol, which would alter a temperature, or Mucinex, cold medications, which might alter blood pressure. Anything the patient may have taken that could alter these vitals, you need to chart. If the patient did not take anything, that's what should be charted there. So then we're going to move on to allergies. And I would say, since there's something written here, I would say, Mary, you still have an allergy to Pentacort? Any other drug allergies? If there's something written there, I don't lead with, do you have any drug allergies? I lead with the information I have and then ask if that's up to date. She says, just that allergy. So we go to the next screen. Okay, Mary, I see you're on albuterol. Did you finish the amoxicillin? If she says yes, she's no longer taking the amoxicillin. She took it for an earache a few months ago, and that's better. You're going to hover over the antibiotic, hit the X, and hit stop. That removes it from there. You only want to keep current medications in this section. So then you hit next. You just put that she's up to date on, UTD stands for up to date on antibiotic, on vaccinations. So her problem list, hang on, honey. Her problem list, you only want to keep current, up-to-date, chronic issues on this problem list. Okay, sorry about that. So you want to look on here, only chronic conditions. So we know otitis externa is not chronic, and that makes sense that it would be there because that's what she was taking the amoxicillin for. You're going to hit remove problem and hit remove. So you're going to want to leave asthma in here because that's a chronic condition. But if you're questioning what's written here, like erythema multiforme, you can leave it in there. Only delete the obvious acute problems that you see. The physician is able to delete something that you're questioning. If you can't come out and ask somebody or ask the patient and you're just unsure, leave it in there and move on. But just make sure that you're doing the best you can to delete and keep this section up to date. So now this is up to date to the best of my ability. I'm going to hit next. Family history. I always ask, is there any chronic health conditions in the family that we should be aware of? And if they say, no, everybody's pretty healthy, this is first degree relatives have no current problems or disabilities. And you'll see that mother and father. We only care from an urgent care perspective about the mother and father's history unless they mention a chronic health condition in a sibling. But you don't have to ask and go into details about, family history. We just need to hit this marker for billing. By all means, if the patient tells you something important, chart it, but don't spend 15 minutes on this section. If there is a chronic health condition, you hit the plus sign. Let's just pick the first one. And then you would select the relative that's affected by it. And add. Okay? You're going to hit next. And then you're going to ask, do you currently smoke? Never smoker. Hang on, honey. And then you're going to hit next. Yep. Yep, hang on, Ev. Then surgical history, you're going to say any. The last section is surgical history. I always ask the patient, have you had any major surgeries and do you have all your organs? The reason I ask that is because oftentimes they forget about like a gallbladder removal. So if it says none recorded, you have to hit the plus sign and select something from this list. Usually it's none reported, and then you have to hit add. If you don't hit add, it doesn't save it. So that's basically, you're done with intake. This surgical history section is my flag that I've done everything. You can either hit done with intake, or if you have to go back for an adult, if their vitals weren't done, I scroll back up here. I chart my vitals, and then I hit done with intake.